Balls Deep.
Welcome to Balls Deep, a humorous yet informative medical show with a mission of optimizing your performance in the bedroom, the bathroom, and the boardroom. I'm your host, Dr. Joe Pazona, a board-certified urologist and CEO of Pazona MD. We hope you enjoy. Now, let's jump right in. Hi, Dr. Joe Pazona. Welcome again to another episode of Balls Deep, where as always I am joined by the lovely Kat Williams. How you doing today, Kat?
I'm still here, thankfully.
Yes, you've made it. You've made it another show.
No one else has auditioned for this role as of yet.
Well, nonetheless, I'm honored and excited to have you again. And so what topic did you pick out for us this week?
Well, I am interested in low testosterone.
Ooh, don't read into that too much.
Yikes, I teed that up really badly. But no, it's a great topic I don't know much about, and I think I'm probably not the only one.
No, definitely not. This is a topic that I think has a lot of controversy, something that is very much front and center in today's era where we're talking about wellness and looking beyond just avoiding sickness. And so I'm excited to kind of dispel some myths today. So.
Okay, let's do it.
Yeah. Well, I think we might as well do that time of the show where we go
Balls Deep.
Okay, so I think we need to start with some more background. So tell us, what is testosterone exactly? And if your testosterone is depleted, where are you?
Yeah. So it's always important to have that good foundation, right? Because sometimes we throw around these terms in medicine. You're like, well,
exactly.
Oh, yeah, I know what testosterone is. And you have no idea.
I have no idea.
So to break it down, testosterone is one of many hormones in the body. And we think of it as sort of the dominant, male hormone, right? We're a man who's filled with testosterone. But actually, women have testosterone as well. And is actually the most dominant hormone in women. And we'll talk about that in future
men
episodes.
and women.
It is, absolutely.
Interesting.
In terms of, now let me be real specific here, sex hormones. So we have lots of hormones. We have thyroid hormone. We have cortisol, which is a hormone made by something called our adrenal glands. Testosterone is the primary sex hormone. And in men, that's made in the testicles. Now, we've all heard of how women go through menopause and that's a guarantee at some point in a woman's life that the ovaries are going to stop making estrogen and progesterone, but they also stop making testosterone.
Okay.
Well, something that's underappreciated, there's a male menopause that people don't talk about. The testicles just kind of get tired.
Interesting.
And what's interesting about this is there's no set time at which this happens. It may not occur at all. There's some 90-year-olds with very healthy testosterones, and I treat some guys in their 20s or 30s with pretty low T. And so it's important to realize that this is a prevalent issue, that testosterone, this male hormone, really has several hundred functions in the body. And I tell guys from the tip of their head to the bottom of their toes, testosterone's playing a role. So some of the symptoms of low testosterone can include hair loss, brain fog, irritability. One of the common misconceptions about testosterone replacement is the guy's going to get rage and get up angry.
Yeah, like the guys at the gym and the steroid rage and all of that.
And no doubt if you're too high, you can get there. But interestingly, most irritable guys have low testosterone.
So it is kind of like a menopause. I mean, all of those things sound eerily similar to what women go through in a menopause situation.
100%.
Loss of estrogen, like you were saying.
Most definitely. Okay. And obviously also testosterone is responsible for, masculinization during puberty. That's what gives men our Adam's apple. It gives us our deeper voices, helps us maintain muscle mass. So as a man starts dropping his testosterone levels, he starts losing muscle mass. He starts gaining fat. The mind starts going. So this is really a big issue. This goes beyond trying to just get gains in the gym.
Low testosterone. It's more of a medical issue, like a problem that you would want to solve and not just leave hanging. So what are the symptoms of low testosterone?
Yeah.
And what would you do about these?
Yes, I mean, there are a lot of the things I just named. Most guys think, well, I have no problem in the bedroom. I'm good. My testosterone's great. Mm-hmm. And usually the wife is like, yeah, trust me, his T levels are fine. But it goes beyond the bedroom. You know, we talk about how we're about performance in the bedroom, the bathroom, and beyond with our practice. And really the beyond part, I mean, guys, just that fire in their belly that kept them going is gone.
So it's like, is it a loss of energy?
100%.
Okay.
You know, so
Okay.
these dads often, right? So we catch a lot because guys come in the office for, say, a vasectomy, but they go, man, I just don't have that get up and go. You know, it's like, I'm getting this little belly. Yeah, I could eat better, but I come home and I'm exhausted and I'm trying to work out. I'm trying to make good food choices.
And it's not just a lack of sleep or something, it's a different level of exhaustion that's being caused by low testosterone.
We'll get into sleep, and it can be a little bit of a chicken and the
Okay,
egg and the
okay.
impact of sleep on testosterone levels. And listen, fatigue, brain fog, weight gain is so multifactorial, right? There's so many different things. And how do we tease out how much of it is testosterone? What I want to get across today is that testosterone is an essential hormone for men that we're talking about today, and that when it's suboptimal, there's a lot of deleterious effects. And
Okay.
I think what's keeping a lot of men from getting on this is there's a lot of myths and fears that we're going to cover.
So, yeah, I mean, if this is a real serious medical problem, the loss of testosterone levels, obviously you would want to do something to replenish these levels. And there is something to do,
Yeah.
which is testosterone replacement therapy. Is that right?
Yeah, so there's a lot of different ways to boost up testosterone levels, and it's probably beyond the scope of this introductory discussion on it. I could talk for an hour about all the different methods you can boost testosterone.
But just in a general sense.
So in a general sense, what we're talking about is there's natural testosterone boosting activities and ways to secondarily get a man's testicles to make more testosterone. And then there's what we're going to focus on today, which is what we'll abbreviate TRT, testosterone replacement therapy. We're going to give you outside testosterone. And again, beyond the scope of a detailed deep dive here, but there are pills, there are topical therapies, there's something called pellet therapy. So there's a lot of different ways to get that testosterone in your body. I think the key point we want to get across is that this is an issue and that it can be safely done under the guidance of a medical expert.
So if it's sort of simple to do TRT, have some replacement therapy, put testosterone back when it's low, why would people not jump into doing that?
There's a lot of myths and a lot
Okay.
of safety concerns about testosterone replacement therapy.
Let's get into those myths. So
Yeah.
give us what's the first biggest myth, the misconception that people think is going to happen to them if they use TRT, and it's completely untrue?
That TRT causes or speeds up prostate cancer. So
Okay.
as a urologist, we treat prostate cancer. We're the prostate cancer experts. We diagnose it. We provide guidance, whether it be watching it, recommending radiation, surgery, whatever sort of, even advanced therapies. And this was born out of studies done, back in the early part of the 20th century.
It was a long time ago.
Long time ago. And what they did show definitively was that if in a model of prostate cancer in an animal, if you cut off the testosterone levels, so castrate, just remove the testicles,
So
get rid
it's
of
just
all
gone. No
all
testosterone is gone.
it killed prostate cancer cells. So we as urologists
Okay.
go, okay, great. Now we're going to start just stopping testosterone, the first sign of prostate cancer. And back in the day, you'd go to a major medical center, they'd remove your prostate and your testicles 2-for-1 special. Or I guess
Yikes.
3-for-1 special.
That sounds kind of rough.
And it was.
Okay.
And what we found was it was completely unnecessary. And that although, yes, prostate cancer cells are what we call androgen sensitive, or another word, androgen's a blanket term for all male sex hormones, testosterone being the dominant, that we can kill cancer cells. But the opposite is not also true, that getting too much testosterone is going to lead to cancer.
Okay.
So it's one of those things in medicine where a lot of times people make these jumps and correlations and go, oh, well, if A leads to B is true, then the exact opposite must also be. And it just doesn't hold
Just
water.
doesn't work that way.
It doesn't. And so I have a number of men in my practice, history of prostate cancer, been treated, and we have them on TRT.
With no problems.
With no problems whatsoever.
Okay.
And in fact, I recently was listening to a great podcast, and the urologist on there was talking about they're doing some trials of men with advanced prostate cancer alternating between removing all testosterone, what that original study suggested back in the 1940s and 50s, and then alternating it with mega high dose testosterone. So actually tricking the cancer cells and giving them too much. So maybe prostate cancer cells like a sweet spot. It's kind of like the Goldilocks theory, not too hot, not too cold. Maybe with testosterone, we want to keep you in a healthy range, and whether you're too low or too high, there's some danger. And I think we see that with some of the other things with TRT concerns.
But definitively, you can say, as a urologist, TRT does not promote or cause prostate cancer.
Correct. If that is your concern, if that's keeping you from
That's
getting
what
your,
you're thinking,
your levels.
and that's keeping you from having this therapy, wipe it out. Untrue.
Correct. Now, it doesn't mean you don't screen for the prostate cancer. It doesn't mean you don't treat it. It does not mean that if a man has an unclear diagnosis or that has an aggressive prostate cancer, we willy-nilly go, oh, this is safe, go ahead and take it. But there's a lot of controversy. We've got some experts in our community who are, give all guys testosterone, you're fine. And then I've got colleagues who, if there's a family history of prostate cancer, won't put you on TRT. Somewhere in between is probably the right answer.
Generally, things fall in the middle.
Yes.
Okay. Second most important myth.
Yeah.
If TRT is not leading us to prostate cancer, what would be the second biggest myth that people are hanging on to and is also not true?
So this is probably a big one amongst the partners of the men consider it, and that's that it's going to cause a heart attack or stroke or blood clot and kill a man.
Okay.
So where does all this come from? Rarely in medicine are there these conspiracy theories that pop out of nowhere. Certainly we have those.
Right, but where are these myths coming from?
So this is based on, again, I think, taking one aspect of a therapy and then drawing too many conclusions that haven't been proven. So one of the, you call it benefits or side effects of testosterone replacement therapy is it will cause an increased production in your red blood cell count. Red blood cells, for those people who are not in the medical field, are obviously what carry hemoglobin and oxygen to all of our cells. Okay. And there's different ways of measuring how, quote, thick your blood is, whether it be your hemoglobin, your hematocrit, your red blood cell count. And there's a vital function. And similarly, you don't want it to be too high or too low. If it's low, we say you're anemic. If it's too high, something we don't talk about too much, there's a theoretical risk of blood clots. Okay. So what is the primary cause of heart attacks and strokes? Well, it's typically a clot that breaks off and obstructs blood flow either to the brain or the heart. And unfortunately, all it takes is one man who's on testosterone replacement therapy to end up with a heart attack or stroke. And we go, look, see, it was the testosterone.
And so they kind of are just arbitrarily drawing a line between a therapy they were on, they had the heart attack, but the two were not connected.
Not always. Listen, are there some guys out there abusing anabolic steroids? Are there some people on mega doses of testosterone with super therapeutic, fancy doctor term for really high levels?
Probably.
That can lead to problems? Absolutely. And by no means, if you're a gentleman with a history of heart disease, open heart surgery, brittle diabetic, should you just willy-nilly go on testosterone and not think that there could be side effects?
But also a lot of those people, I would think, correct me if I'm wrong, may not be under the direct supervision of a physician.
Yeah, I would say. Is
that possible or is that not true?
Yeah, I mean, certainly the younger guys, absolutely, but there are certainly some older folks who are being watched by physicians. And if anything, they're being told to not do any TRT because it's potentially dangerous. So we recently had this landmark study. So let's go to the science, right?
Yeah, always to the science.
Let's go to that. And it was called the Traverse study. And what this study did was it looked at about 3,000 men and studied them for several years. And interestingly, these groups of men actually had some risk factors for heart disease.
They already had existing risk factors.
They did. So they didn't take like the healthiest of the bunch.
Okay.
And they put them on responsible doses of testosterone replacement therapy.
And were monitored.
And they were monitored. And they did not have an increased risk of heart attack or strokes. And so this is, again, proving that concept that it's not all or nothing. You made a great point earlier. A lot of things in healthcare, there's a gray area, right? It's somewhere in the middle. And so what I want to do is make sure that I'm not coming across as saying categorically all testosterone is all safe in all men at all levels. That's not true. But what I do want to do is hopefully encourage more informed discussions to get men and their partners to say, listen, there's a real risk to sitting around with low T levels. And in fact, if we draw again from earlier prostate cancer studies, remember all those guys we cut off their testicles when they had cancer?
Yikes. Yes, I remember that.
Do you know what we caused beyond bedroom problems and lots of hot flashes?
What?
We caused heart disease.
Oh, how interesting.
So how is it that when we dropped their T levels to 0, we actually caused heart disease? Oh, and by the way, osteoporosis, testosterone's important for bones, and we destroyed their quality of life.
So it completely went the other way.
Exactly. And so it shows again that you can't always make these assumptions, and that what I'm starting to believe with the testosterone world, because I'm still learning this, it's medicine's about strong beliefs loosely held. And a lot of what we learn is untrue, but it's becoming more clear to me. There's this sweet spot, and that too low is just as dangerous as too high. And so that's what I want to kind of encourage is let's check the levels. Let's have that informed discussion. And then we got to treat each man like an individual. It's great to have a population study, but we got to look at that person who's in front of us.
But no one is the same as someone else. And you're going to be
Exactly.
working with your medical professional to see what is right for you as an individual.
Absolutely.
Okay.
Absolutely.
Well, these are two pretty big myths that are kind of being knocked down. I think you had a third that you wanted to share.
Yeah, I mean, I think it's a great lead in that, traditionally, healthcare professionals will see a man and we check what's called their total testosterone. How much testosterone is in their bloodstream at that moment?
That's when you say total, you mean total, like
Correct.
The whole shebang.
Yep, absolutely.
Okay.
Now, 95% that's from the testicles.
Okay.
But what's interesting is hormones need carriers. They require transportation. They don't just float through the bloodstream by themselves.
Okay, I don't know this.
And so testosterone is grabbed by two proteins, one called albumin and one called sex hormone binding globulin. Protein.
Fairly aptly named.
Right, a protein that grabs or binds the sex hormone testosterone. So actually 98% of the testosterone that we make is being unused. It's inactive. It's grabbed by that protein. And so when a man goes into his physician and checks his total T levels and they quote are normal, okay?
So I'm sure there's a range of numbers and there is
Right.
a quote normal zone.
Exactly.
And if you don't fall into that zone, or if you do,
you're told, hey, you're fine. Just stop whining. Just
because
exercise
your number
more.
fell in the bracket.
Your number's fine. You're within normal.
Okay.
Now let's talk. So there's two subtleties here that I want to hammer across. Number one, a reference range tells you where 95% of the population typically lives. That doesn't mean that those levels are all optimal. You can be at the lower end of normal, and that's not best for you and your body.
And you may be feeling off. You may not be feeling
absolutely
as good as you could.
Yep.
Okay.
The second thing is because most of the testosterone is bound, what's actually more important is something called your free testosterone. So that's how much is available for use. So that's what I like using to guide whether a man should be on therapy.
To give a better gauge of who needs and how much.
Yeah. So here's how I explain it to a lot of my patients, and hopefully this will resonate with you and to our listeners. Think of total testosterone as going into your accountant and they calculate your net worth and they go, oh, Catherine, you're worth $500,000.
If only.
And you go, great. I got $500 in my checking account. Where's the other 490?
Where's the rest of my cash?
Right. Where's my
Right.
cash? Right. So we all know in finance, liquidity is king. Well, hormones is exactly the same. Liquidity is king. And so if most of your testosterone is being bound up by these proteins, who cares what your total levels are?
Because it's not utilized.
Exactly.
Okay, that makes sense to me.
And so, unfortunately, our education on this is horrific. The traditional medical education, even as a urologist, was this: if a guy's level, so the total T levels range between about 250 and we'll call it 900 based on what your lab tests, and that varies a little bit. So what we were taught is if a patient's level is above 250, tell the guy he's fine to stop whining and get him out of your office. If his level is below 250, give him the least amount of testosterone necessary, tell him to stop whining and get him out of your office as quickly as possible because he's going to be a pain in the butt. And that's just irresponsible. And so these guys are left going, but I don't feel good. And wait a minute, my buddy goes to this low T center or gets some from the gym with the bros, and he looks and feels great.
Why can't I get
I'm just
going to
go do that
therapy? And then he goes to a center or a place that's not maybe in conjunction with his physician.
100%. And again, I'm not going to speak, when I say this, I'm speaking in generalities. I'm not bad mouthing any particular hormone center or any brand by any means.
No, but I think your point is well taken. It's an individual assessment with your physician.
100%. And that I think, unfortunately, because of the poor education even I received
Sure.
On this matter, I've had to learn it myself because I started going, why are all these guys going to these other places and they're feeling better? There's got to be something to this. And you learn there is. And so, when in doubt, you could follow the dollar, and we could talk about that later as to
It's a whole other conversation.
Many times in healthcare, right, where we're not following maybe what's best for patients because there's not money to be found in that. But this is one of those where I'm trying to be a responsible steward somewhere in the middle. As a urologist, I treat men with prostate cancer, prostate problems, but I also treat troubles in the bedroom. And as we've talked about before, I feel very passionately that I've got to treat the whole individual in wellness. And so I want to be that responsible steward between the bros getting juiced up in the gym and the people who are being dismissed by the rest of the medical community saying, this is stupid, this is dangerous, don't consider it. There is a happy medium. And the proof is in the pudding because we see the impact this has on people. And interestingly, the number one thing guys come back and say, and their partners, I'm just happier.
Not even I feel better, I'm just happier.
Yes.
Interesting.
It's not, oh yeah, I'm getting great gains in the gym, or yeah, we're doing it a couple times a day. This is awesome. And the wife's exhausted. No, I mean, it's the brain. And so you think about how many men are walking around there with suboptimal testosterone and the impact that has on their relationships, on their performance in work, and then their overall health. Because guess what? If your T levels are low, you ain't going to the gym. You're not making good food choices. Sleep is disturbed. And then that vicious cycle continues.
It's a vicious cycle. So all this low testosterone has to do with overall wellness and feeling good.
Yeah.
I mean, for lack of a better way to put it, feeling better.
Yeah, absolutely. And so that's the point I want to hammer across today as we kind of get toward the end here, is that there is a happy medium. There are people out there like myself and our team who really look at it from an individual approach, try not to be rigid and be responsible. Because no doubt, listen, there are a lot of things we can do to a patient with pharmaceuticals and surgeries and other things that make them feel better, but it causes downstream effects and can hurt them in other ways.
Okay.
We're not one of those people who are just blindly handing out testosterone, but we've got to meet somewhere in the middle here from where our healthcare community is and what our patients need.
It all lies somewhere in the middle.
Absolutely.
I feel like everything in life lies somewhere in the middle. Well, this was a great topic today. I certainly learned a lot. I think we should bring it all down for our readers and crystallize it in a summary, a naughty little summary we like to call. So today, I think the three things we wanted to hammer home: the myths of low testosterone. Number one, TRT causes prostate cancer. Nope. 2, TRT causes heart disease. Also a nope. And 3, your T levels have to be, quote, below normal to be a candidate for TRT. Also not exactly true. So I think it's a big deal for people to understand that these are myths. They have been dispelled here today. Obviously, TRT is a very individual process, and your levels and treatment that you need is going to be decided between you and your physician on an individual basis.
Yeah, I think that's a great summary, Kat. And again, any one of these comments could be taken out of context. Someone's going to go, wait a minute, I knew someone who had a heart attack because they were on testosterone.
And everyone is different.
100%. So again, I don't want people leaving today thinking that everything is safe at all doses. Listen,
Certainly not.
Aspirin and Tylenol will kill you at the wrong dose.
Absolutely. Absolutely.
You know, chemotherapy at the right dose will kill cancer cells. At the wrong dose, kills good cells. Everything has a therapeutic range, and we need to look at testosterone like that. I just feel we are too heavily skewed to the danger side of it right now, on the medical side of things. And on the flip side, we are too skewed to the TRT is great on the bro side of things. Mm-hmm. That's why I'm calling for a meeting in the middle between these two camps. And, you know, I think one last thing, you know, there are actual side effects, but the one, if I had to say that really we need to bring awareness to of those guys who are on it, is when you start testosterone at a really young age, okay, most often in the gym, anabolic steroids,
physical gain of
right,
musculature
for no reason other than you're trying to get jacked.
Okay.
That in a young man, that can permanently impact their fertility, and it can also permanently shut down the testosterone factor in the testicles. So that's a real concern. And I see patients who go, yeah, doc, I got to be honest with you. When I was in my 20s, I cycled, you know, on and off. And now they can't have kids and their T levels are in the toilet. That's something we got to really crack down on, and is certainly scary. So I want anyone who's young, who's thinking about having a family one day and doesn't have kids, anyone who's just thinking of it for all the positive gains, really caution you against that. I mean, that's where having a medical professional can really come in and help you out. So all of this, again, is about a balance, meeting in the middle, and it comes down to the dosage and each person and where they are in their stage of life. So,
well, I think that's fantastic information. Thanks for sharing with us.
Absolutely, Kat. Well, thanks for another great episode.
We'll see if I'm coming back.
I think so. And
looking good.
Thanks to all you listeners out there. Just a reminder to show yourself love and grace as always. We are all works in progress, and that gives us opportunities to improve. Have a wonderful day.
Thank you for listening to this week's episode of Balls Deep. If you'd like to join our stream team of listeners, please click the subscribe button on your favorite podcast platform. For more information about our practice, Pazona MD, please visit pazonamd.com. This podcast is for informational purposes only, and the content is not intended to be a substitute for professional medical advice. The show does not constitute the practice of medicine. No doctor-patient relationship is formed through this podcast or any of the social media channels related to this show. The use of this information is at the user's own risk. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.